We are speaking with Mr. Ted Wolfendale, who is an attorney and administrator of Dalinurse Home Health Agency. Dalinurse is the oldest home health agency in Southwest Florida. Mr. Wolfendale, what are the most important things you should know prior to hiring a caregiver?
Well, the first thing that you want to be aware of is whether or not the person that you're hiring as a caregiver is going to be an employee or an independent contractor. If you have somebody that is an independent contractor that comes into your home, you need to be very careful for a variety of reasons. Taxing is an issue that people don't think about, and independent contractors are responsible for paying their own taxes. If they don't pay their taxes, somebody has to pay the taxes. And there have been some horrible stories where even people that are independent caregivers that had a very good relationship with their patient at the time the patient passed away were found out to have not paid taxes, and the IRS has gone back after the estate. Also, you want to run background checks before you have anybody come into your home. You want to find out, do fingerprinting if you can. You want to have them drug tested. You want to have workers' compensation in place, and you want to have liability insurance. Most people don't think about this, and that's one of the major differences between independent contractors and home health agencies. Home health agencies in Florida are required to have liability insurance in place. Unfortunately, a lot of times people just look at hiring an independent contractor, a neighbor, the people we call Mrs. Doubtfires, that they see sweet little grandmother types that advertise in the classified for a few dollars an hour less than what a home health agency would charge. But what the people forget to think about is this person going to be supervised? Because the state law requires that a director of nursing supervise the entire staff that goes into somebody's home. Is liability insurance going to be in place? Can they really trust the person that they have in the home? Have they been drug tested? Are their skills up to par? Now, the best people to determine whether or not somebody's skills are up to par are people that do it on a day-to-day basis, such as a home health agency. So, in my opinion, home health agencies, wherever you are your safest bet. They are monitored by the government. They have certain requirements. There are certain mandates that the staff have continuing education to keep their skills up to par. They're constantly supervised and watched. And so the last couple tips I would give would be you need to think about if, again, the independent contractor you hire becomes injured on the job. You then are responsible for their particular claim, and you don't have somebody else to come in and take their place, as you would with a agency that's governed by the state. In that situation, if you hire a home health agency and somebody becomes injured, it's the responsibility of the agency, so you transfer that burden to them, and they immediately can put somebody in place of the person that's become injured. And I think the final tip about hiring a caregiver would be, a lot of times people become injured and have to go to the hospital. It could be they fall and they break a hip or a shoulder, whatever it is. And you're there for a couple of nights. What people don't think about in hospitals everywhere are patient-staff ratios. So if you have a situation where you become injured or a loved one becomes injured and you are required to go to a hospital, I would suggest that you contact the hospital and find out the patient-staff ratios. Because if you find out, like many places, that are 6 to 9 to 12 or more patients per nurse, then you might want to think to hire somebody from an agency for that period of time that you're going to be in the hospital. Because if one nurse is responsible for taking care of 9 patients and you or a loved one need something in the middle of the night, when you ring that bell, they may not necessarily be able to get to you for a period of time.